Hi, I'm Ajay Vora. I'm Professor of Pediatric Hematology at Great Ormond Street Hospital in London. I have been asked today to give you a brief overview of personalized treatment in acute lymphoblastic leukemia. And my focus is going to be on the developments in particularly children and adolescents with acute lymphoblastic leukemia. So you can look at personalized medicine broadly as tailoring treatment to the individual patient. And there are many different ways of doing that. Particularly in ALL, there are four broad ways in which we are developing methods to personalize treatment in ALL. Firstly is to refine our risk stratification algorithms so that we can better predict the children who will respond and be cured by our current treatment strategies. That then enables us to limit the more intensive treatment to patients who have a higher risk of relapse and de-escalate treatment for those who may not need intensive treatment to cure them. Secondly, to use the new high-resolution genomic methods to find genetic abnormalities that can themselves or their proteins be targets for specific drugs such as tyrosine kinase inhibitors like imatinib for patients with BCR-ABL or Philadelphia-like mutations. Thirdly is to investigate the host genomics in order to identify patients who may respond in an unusual way to standard treatment, either by showing more resistance to that drug or by having excess toxicity. And an example of that is the use of TPMT genotyping to direct dose and agent that we use for thiopurine treatment during the long maintenance phase of treatment that we have to use in ALL. And finally, it is to adopt newer treatments, such as, for example, immune therapy, in order to both improve the efficacy of treatment for high-risk patients as well as reduce toxicity. And that itself requires that we can tailor the treatment to the individual patient's leukemia depending on their immunological and flow cytometric phenotype. The upcoming European Hematology Association conference, EHA 2020, that starts on June the 11th, is going to have a hematology in focus session on personalized treatment in acute lymphoblastic leukemia with two eminent speakers, Dr. Boquin and Dr. Yang. Dr. Boquin is going to talk about using functional profiling of primary leukemia blast cells in order to identify agents which may work better in some patients rather than others. And Dr. Yang is going to talk about host genomics and the role it plays in both how an individual patient might respond to treatment as well as their risk of toxicity from particular agents. Thank you for listening.